Hello, everyone, and welcome to our new Facebook Live. It's Alex from Luma Health Insurance. And today we will talk about the COVID vaccine side effects, all you need to know. Why we choose this subject, because we all know that it's pretty trendy and everyone have a subject on TV, on radio. But today we are very glad to invite our doctor, and you all know him. It's Dr. Gerard Lalande, our Chief Medical Officer. So welcome, Gerard.
Bonjour, merci Alex, and bonjour to everyone listening to this Facebook Live. I'm very pleased to be here as usual. Thank you, Alex, for the invitation.
You're welcome. So as you know, I'm quite sure you are in the middle of this subject about the COVID vaccine effect, the COVID vaccine in general, and also the COVID-19 pandemic as well. So the first question will be, what are the common side effects of the COVID-19 vaccine, actually?
You have the usual side effects of any vaccine, which is the pain at the injection site, which is a bit painful for a few hours, sometimes 1 or 2 days. Usually after a vaccine, there is a reaction from the body, which means there is also a stimulation of the immune system, which makes kind of fever, sometimes body ache, muscle pain, and usually this doesn't last so long, about 1 or 2 days. So most of the time for different vaccine of COVID-19 is still the same. However, there are some specific also side effects which can happen. In the short term, you can have also, this is rare, but it can happen, what we call a very severe allergic reaction, which usually happen within 10 to 15 minutes after the injection. So this is for those who have a predisposition for this kind of severe allergic reaction. And that can trigger serious symptoms such as difficulty in breathing, very severe difficulty in breathing, drop in blood pressure, which make them feeling very uneasy, kind of intense malaise. And if it's not treated rapidly, can even lead to life-threatening conditions. So people can even die from anaphylactic shock. So this is rare, but it can happen. This is the reason why in every vaccination site, there is a compulsory waiting period after the injection, which is about 15 minutes to 30 minutes, depending on the country. Here in Thailand, we keep 30 minutes, which I think it's quite good to do that. And there is, of course, monitoring by usually a nurse, which is an ICU nurse, and the doctor is nearby also. So in case somebody gets this severe allergic reaction, there is an immediate answer from the medical team. Now, there are also some specific side effects related to the different type of vaccine. This is more on the medium-term side effects. So the RNA messenger type of vaccine, which is Moderna and Pfizer, have been found to induce some kind of inflammation of the heart, which is called myocarditis. This happens more specifically to young men, usually between 18 to 30 years old. It seems to be just not too severe, transitory, doesn't need so much treatment. Sometimes they have to be hospitalized and receive anti-inflammatory agents. But usually it's resolved by itself. But there is some source of concern for this inflammation of the heart, because why it happened and why young male especially. So there is still a question mark on this, which is not completely known. There were also some side effects related to some neurological disorders found with RNA vaccine, which is a kind of neurological disorder, which is a little bit related to multiple sclerosis, which is also a concern. It seems to be extremely rare. We are not really entirely sure that it is linked or attributed to the vaccine, but it has been reported in the clinical trials with Pfizer in particular. Now, the AstraZeneca, which is a vector vaccine, has been involved. I mean, we have found some case of, even though it is rare, some case of blood clot, which sometimes can be quite severe because it can go to the brain. So in other words, the blood clot can induce a stroke. And there were some issues with some people triggering a very serious condition and even death. So these specific side effects of AstraZeneca were found in women and also quite young, between 25 to up to 40 years old. And this is the reason why AstraZeneca has been reserved to the older people. And in some countries, vector vaccines such as AstraZeneca and Janssen are reserved for people above 55 years of age. And as a consequence, the RNA vaccines are used for the younger people. So this is the short term, as I discussed earlier, which is not a big deal, except for the anaphylactic shock. Then you have the medium-term side effects related to different types of vaccine. But one thing which we don't know yet is the long-term side effects. When I mean long-term side effects is after 2 to 3 years. And I'd like to make a parallel with the dengue vaccine. The long-term side effects were found after 3 years of use. And in some cases, it shows that these long-term effects were quite serious and make more reservation to use the dengue vaccine in different populations. So, however, as a whole, for the time being, based on what we have seen, there is still, according to at least WHO, CDC, Atlanta, and so on, a firm belief that the benefit outweighs the risk of the vaccine. So meaning to say, the vaccine are still recommended, especially for those who are at risk. So I'm pretty convinced that those above 55, 65 years of age needs to get the vaccine because they are more prone to develop the complications of COVID. But now for those who are younger, I think there will be another question later on. This is still a question mark.
Okay, thank you very much, Doctor. I have another question because before this subject, I make some Google research, to be honest, and I found a word, medical word, anaphylaxis. Sorry for the pronunciation. I would like to know what it is, and can you explain us what is this special word we can see quite everywhere?
Is what I mentioned earlier. Anaphylactic shock or anaphylaxis is an overreaction of the body to a specific allergen. Some people are allergic to pollen during let's say the summer period. Some people will have running nose. This is kind of allergy to some substance in the nature, or sometimes people can be allergic to some medications. People can be allergic to aspirin, to some antibiotics. So this kind of allergy, most of the time, does not trigger a very serious problem. They just trigger some rash, some uneasy feelings, but are easily to treat and disappear by themselves. But in some cases, some people will be very sensitive to this allergen, and the body will have an excessive reaction to that. It will release some specific substances. One of them is histamine, which will vasodilate the vessels, which will lead to a drop in blood pressure, and also narrow the airways, which means your system to breathe will be affected. It will be much more difficult to breathe. So anaphylaxis or anaphylactic shock, which goes together, is the most severe allergic reactions, which can happen also with vaccine, but also with food and also medication. And this needs to be immediately treated with specific medication called epinephrine or adrenaline. And those who have been exposed to anaphylactic shock in the past, they will usually carry with them a specific medication. Every time they go out, they will have this on their pocket, and they can inject themselves in the leg this kind of adrenaline medicine to treat immediately the severe allergic reaction. It can happen also, although it's very rare, but it can happen also with the vaccines for COVID-19. Mm-hmm.
Okay, thank you for this answer. Another questions about what should we do if we find some side effects occur after the COVID vaccine? Do you have any? What should we do actually?
Okay, so you have to distinguish the first phase, which is just after the vaccine. Normally, people are obliged to stay for 15 to 30 minutes in the vaccination center. And here is where we are going to diagnose if ever some anaphylaxis happening. Okay, so here you have all the medical team, which is ready to do whatever things it's needed to do. Then, if the person goes out of the vaccine, when the person leaves the vaccination site and then experience some fever, minor fever, body ache, sometimes it can be also vomiting, diarrhea, headache. If this is still, let's say, acceptable for the person, depending on the threshold of pain people can accept, normally they just stay at home. If they have fever and pain, paracetamol will suffice, but don't immediately jump into paracetamol if you have only 37.6 degree. You can still wait for a while, and most of the time this disappears by itself. So now, if the headache becomes very severe, we had one case here in our company, obviously it's needed to seek for medical opinion, and the person has to go back to the hospital, usually the same place where they got the vaccination, and then express the symptoms, and there will be management of care will be done at that moment. Now, if they develop longer medium-term side effects, which I mentioned, myocarditis, for instance, which is chest pain for the young people, especially male, or if they have some more serious symptoms related to blood clot, which will be related to symptoms of stroke, which means sometimes some kind of abnormal motion or leading to some kind of half paralysis, difficulty to speak. Sometimes the eye drop, the lid will drop. You see half of the face, which is not feeling the same. So in that case, if you have this kind of symptoms, which could be related to blood clot formation, in that case, you have to rush to the hospital. Rush. It's very urgent. Okay. Now, for the long-term side effect, we still don't know. Because as you know,
so yeah, it was my last question, my next question about the long-term effect. So actually, we don't know, right?
That's a problem, Alex. Yeah. If we go back to the different technology used for the vaccine, at the moment we have three main technologies. One is the traditional one. They use a kill virus, which is a coronavirus, to kill it, inject. So this has been done for the last 70 years. Of course, there could be some immediate side effects, possibly also anaphylactic shock, but afterwards, let's say side effects are pretty straightforward because usually there is not so much things. Okay, now the vectors vaccine, which is the AstraZeneca Janssen, here we still need to get a little bit more experience with this vaccine, because for the time being it's only less than a year, and we still don't know, beside the blood clot, for instance, what else could happen also, because it's still a technology involving some genetic manipulations of the vector. Okay, so but in a way, the second technology related to vector vaccine is something which we have been using for the last 20 years. So they are not so much concerned about what can happen, hopefully. Now, the third one, which is RNA vaccine, and you know my opinion on that, is, for the time being, it seems to be fantastic because it induces a very high, let's say, rise in antibodies, neutralizing antibodies. But this technology has never been used before. It's totally new. So it might be, in the next future, a therapeutic revolution. And it's not only for the developing vaccine, but it will be also used, this RNA messenger technology will be used to treat severe disease like multiple sclerosis or cancer. But for the time being, we don't know. We don't know, and we decided to vaccinate millions and millions of people, and we unfortunately don't have long-term experience and result about this vaccine beyond one year of use. So for the time being, it's quite short, And the best scientific and only correct scientific answer linked to what about the long-term side effects of RNA vaccine is we don't know.
Okay, thank you very much for this answer. It's pretty clear for all of us. So now we know what happened when we have some problem with the vaccine, some side effects. I would like to know also what are the benefits of getting the COVID-19 vaccine, because of course we can see from outside like it's reduced a lot of people infected.
Okay, the objective of vaccine is to prevent the disease, but unfortunately, it may not always prevent. In some cases, you do not get the vaccine at all, the disease at all, but in some cases, you still get the disease, but you will express less symptoms and you will have not a severe form of the disease. So what is said now with the different vaccine used is, even though it doesn't totally prevent the spread of the virus, but it prevents a lot of cases of people who will not develop the disease. And for those who still develop the disease because of the vaccine, they will have a minor form, which means they may not be sent to the hospital, they may not go to ICU, and they may not die. So this is a theory. But there are some reports already in France, because I'm following more in France, that even vaccinated people can still go to the hospital and even go to the ICU and even die. So it's not a total guarantee that because you are vaccinated, you are totally safe forever with this particular virus. But obviously, vaccination is useful, is one of the main weapons we have to limit the spread of this disease, because it's the best way to generate what we call herd immunity. Herd immunity will come from people who have been infected by the virus. They will be immune to the virus for at least for a few months or maybe a few years. And the same apply with the vaccination. When you inject vaccination, you also induce immunity for the long term. Again, long term is also a question mark now, because we know that usually coronavirus doesn't induce a long-term immunity. So it means that boosters, probably annual boosters, will be needed to maintain this kind of immunity level. But vaccine should be, of course, one of the main tools, but not the only one. And this is something which is a bit sad to hear, that it looks like for the common people that the only way to limit the spread of this disease, the only way to fight coronavirus is vaccine, and that's it. Actually, it should be also medication. It should be management of care, because even for those who have been vaccinated, there will be still some people who will get sick with the coronavirus. Okay. Mm-hmm. So now, in terms of efficacy, you have probably heard that the first group, which is the attenuated virus, the whole virus, like the Sinovac and Sinopharm, these are traditional vaccine. The efficacy is credited about 50 to 60, 67%. Not great, but it's not so bad already. And the interesting point of this technology is the whole coronavirus is injected. So the body can produce antibodies not only on the what we call the famous spike protein, the small spike which help the virus to enter the cells. They can also produce on other sites of the virus, because they have the whole blueprint of the virus. Okay, but efficacy doesn't seem to be so high. That's about 60%. It might be also more effective against new variants, because they get the whole blueprint of the virus. Okay. The second technology, which is the vectored type of vaccines, which is Astra and Janssen, and the same for RNA vaccines, Pfizer and Moderna. Most of the immune reaction is triggered on the spike protein. So once the spike protein mutates, then there can be a big issue about efficacy. But for the time being, with the original source of strain of Wuhan, the efficacy range between 75 to up to 95%. This is the official percentage of efficacy from clinical trials, which is a bit not exactly what is the real world. although there was a study published in Israel, because Israel was a country where a lot of vaccine happened very quickly.
Yes, correct.
Very huge coverage over there. They were more or less saying that the efficacy in the real world was close to 92%. Okay. Now, good study, but most of the people, if not all, who signed this study were from Pfizer, or with very strong conflict of interest with Pfizer. So nowadays, people are a bit skeptical to have these not really independent researchers to sign clinical papers. From the group in France, which is an independent group, the efficacy related to almost all vaccine available in France, which is the 2 RNA plus AstraZeneca, is about 70, 75%, maybe 80%, but not really 95%. Okay. Nevertheless, it's already good. It's quite good. So the benefit of the vaccine is interesting because we believe that there will be a strong impact on the progression of this disease, but it may not be enough because with the new strains, as I told you, for this main vaccine as vector vaccine and RNA vaccine, since everything is focused on the spike protein, a big mutation of the spike protein will make this vaccine not really effective. So they will be needing to have a new generation of this type of vaccine as a booster to maintain a good level of immunity with the new strains coming.
Okay, pretty clear. And also we have all the information of the benefits and risks. So we have a question. Not risk.
Not really, because this, for the time being, we have a good benefit of using the vaccine. We can see, let's say, in real world, about 75 to 80% efficacy. But it's just after 1.5 years after the start of the epidemics, and the availability of vaccine is even less than 1 year, because the first vaccine used were in December 2020, so it's less than a year yet. Okay, we don't know the side effects of this vaccine. So the very important aspect of any medication or vaccine is to have a clear analysis, a clear view about the benefit versus risk. Benefit we have seen, risk we still don't know. So the real benefit risk of this vaccine will be known probably in the next 1 or 2 or 3 years. That's the reality here. And that's why, and that's very important for everyone listening here, all these vaccines are not officially approved. They are used because of the urgency of this pandemic. So they are used with a certain, let's say, legal facility in a way, which is called emergency use authorization. Because of the emergency of the pandemic, the regulators, FDAs, EMEA, for instance, have accepted to grant the permission to use this vaccine, even though we had no clear idea about the real benefit risk.
Okay, it's almost pretty clear now that we don't know what will happen in the future, but we are at least in a benefit way for the moment. We have one question on this Facebook Live from Emir. He asked, is it possible that after the vaccine, I will get positive to the COVID test, if you do a COVID test again after the COVID vaccine?
But if you get a COVID vaccine and you are unfortunately in the 20 or 30% of those who do not respond positively to the vaccine, which means they can still contract the disease, then you have a positive PCR test because you contract COVID-19 despite the vaccination. The second reason you can have also a positive test is you get a false positive test. And we know that there are many false positive PCR tests also. So yes, it's possible.
Okay, thank you for Emir. And do not hesitate to leave your comments on the comments line during this live. Dr. Gerard will be happy to answer. Just before my last question, so I would like to ask you if you have some advice to give to people about the COVID-19 vaccine, a general advice and also your advice.
Okay, this is it's always difficult for a doctor to express opinions. this is purely an opinion, and for anyone who is going to get his COVID-19 vaccine, it's important that you by yourself review the literature and try to understand what this vaccine can provide as good things and what could be the possible risk of that. And beyond this, you cannot go to a vaccination site without seeing a doctor. In every vaccination site here in Thailand, there is a doctor available here because officially you need, there is a requirement by the Thai MOPH to fill up a questionnaire. And the questionnaire will look at your past medical history and whether you can be vaccinated or not. For instance, someone who got a vaccine for flu, for instance, the day before, you will not be accepted to vaccinate immediately. Even though I heard that the CDC of Atlanta is also accepting now, almost at the same time, flu vaccination and COVID-19. But at the moment, in the Thai protocol, you have to wait about 2 weeks before getting a shot with the COVID-19. Okay, so my point here is there is a doctor, and the doctor is available anytime to answer your questions for your specific medical background, for your specific reasons to be vaccinated. And this is the way you can finally decide by yourself with the advice of the doctor who is at the vaccination center. Now, I believe that for scientific reasons, vaccine is needed now, especially again if you are among the high risk group. So people of my age, just 25, a bit more than that, we need a vaccination. Even though we may not be so happy to get it, because all this controversy in the past couple of years. But yes, vaccination seems to be effective, risk-wise, especially for the traditional one and the vectored one is pretty known now. So benefits seems to outweigh the risk. So especially for the high risk group or those who have comorbidities like heart problems, severe obesity, diabetes, immunodepression, for instance, definitely vaccine is needed. Okay, it's a bit more difficult for those who are in perfect health, who have no specific medical concern. The benefit risk is not as clear as we would like. Of course, people are saying that you and these people should be vaccinated because they could also be a source of spreading the virus. And an extension to that will be the kids now, below 18 years old. As you know, Pfizer is already available from 12 years old and onwards. And I know that studies are ongoing now to show also that it should be also beneficial to use it even earlier than that, up to 3 years old. Okay, so this is a big question now, because if you look only at the young adolescent and kids below 18 years old, the mortality related to COVID is 1 out of 1 million. It's extremely low. This does not justify vaccination for this group. But the concern of the ministries of health is this group, in a way, is keeping the virus and spreading the virus to other people and can still maintain this kind of circulation of the virus. And because of this group, which is unvaccinated, if we don't vaccinate, we will not reach the herd immunity. So that is a rationale for the regulators to move down the age up to now 18, 12, and maybe lower later on, to make sure that we can reach this herd immunity. But again, herd immunity is not clear. There is no clear data showing that we should reach 70% of herd immunity either from the disease itself, which people will get immune reaction, or from the vaccine. Whether it should be 80% or 90%, nobody knows exactly this. But what is said now in different ministries, including in Europe and here in the US also, is to say that we need to vaccinate the most number of people to be able to reach this herd immunity because of the new variants. So new variants, in a way, is an additional tool to explain that more people should still be vaccinated. Okay. So it's a decision which is personal. Everyone is free to now to take a decision whether they need vaccination. My only recommendation will be clear for those who are at risk with comorbidities. Obviously, it's needed. And for those who feels they don't have so much risk to catch the disease, or even if they catch it, they have no risk to go really to ICU or to die from that. Mm-hmm. Just remember, just remind you that the average age of people who die from COVID in Europe is 80 years old. So it's really a disease for the very old people, and especially those who have comorbidities. So in line with this is an important decision, and you need to refer to your doctors whether you need this vaccination or not. But in general now, on the political side, to be politically correct, everyone should be vaccinated. But on the medical side, it's not as clear as that.
Okay, so yeah, you answer all my questions actually, and it was very good for also the people who are writing down some comments. So thank you to all the people on the chat as well. Gerard, I would like to thank you for all this information and also for your advice. It was very helpful for our members, and so thank you very much, Gerard. I hope to see you soon, and so I would like to thank also all our members, all the viewers right now. You just need to know also that Luma provides services with the second medical opinion from Dr. Gerard. So sometimes if you are not sure of what the doctor at the hospital said, you can consult us, and especially Dr. Gerard. So this is the end of our Facebook Live today. Thank you very much, Gerard. I hope you enjoy answer my questions. And I hope to see you soon for an update, maybe in September, October, November. We'll see if we have some new number and new insights. Yes?
Yeah, it could be an update. We have no time now. I think we have finished this.
You're free.
But maybe the audience will be interested to know. Anyway, it's too early to discuss this. But you have seen probably in the news that more and more people are recommending a first vaccine by one technology, for instance, Sinovac, and then for the second injection, instead of using the same, is using another type of technology like AstraZeneca, Sinovac, and then AstraZeneca, for instance. Okay, so this will be a good subject to be updated in the future. For the time being, it's very new, very few studies to back up this new type of process. And we'll see after the summer holiday for those who have the chance to take vacation like you, Alex, to make another Facebook Live.
Yes, with pleasure. Thank you very much. And I wish you a great day. Great day to all the viewers. And do not hesitate to leave your comments, your questions on the comments lines. We will be happy to answer with Dr. Gerard. So I wish you a great day and see you soon. Bye-bye.
Bye.